My name is Emily Balmer and I am the Director of Audiology at the Hearing Suite in Harrogate. So I just wanted to talk to you a little bit today about the kinds of home ear care remedies that exist. So if you go onto Google, you will see all sorts of different remedies, different advice. I just wanted to give you some suggestions from the point of view of an audiologist. In my practice, we do an awful lot of microsuction wax removal. So that's the wax removal where we use the tiny little hoover. We look through the ENT microscope and we remove the wax little by little. But yes, I just wanted to give you an idea of the sorts of products there are, what they do, do's and don'ts, just to give you some advice. So, if I look at this one first, so not really brand specific, what I did, I just wanted to find one of each. So, this one is your typical olive oil. So, if you have a blockage of wax, people will often recommend that you use olive oil. And this one comes with a handy little dropper. So some of them come with a spray, which is great for maintenance, if that's what you've been advised to do. I have different opinions around that, but that's a whole different topic. So a dropper is a really good way of getting plenty of oil into the ear. If you are wanting your ears syringed, then olive oil is a must. With microsuction, personally, I either like the ear free from oil completely or absolutely drenched. It's when it's somewhere in between that it's really difficult to get out. So yes, that's your kind of standard olive oil that a lot of GPs and pharmacists will sort of instantly recommend. It does a good job of softening wax. So earwax is produced in the outer portion of the ear canal. And in theory, if we ate a balanced diet of different cuts of meat, raw vegetables and fruit, our back teeth and that chewing would just work the wax out naturally. But some of us have very narrow ear canals, quite bendy ear canals, and our diet is often very soft, so the wax can build up and stay. So that's your olive oil that won't do any damage to the skin. When it goes into the ear, the wax will swell. You will feel more blocked until somebody is able to remove it for you. So pop this one back over here. So next up, this. So it's when we have to start looking at the ingredients now. So these are just earwax remover drops, and you'll see lots of drops like this in pharmacies and chemists. Sometimes they have specific brand names. Yes. So with these are a drop. So it's just a drop from a bottle. The thing to note with these is that they contain hydrogen peroxide. And hydrogen peroxide, as you'll know, is bleach. So I would say if you have these in and you're very much wanting to use them, proceed with caution. They'll probably fizz as they go into the ear canal, as they touch onto the wax. A drop with hydrogen peroxide in doesn't tend to be in my top 3 choices. The drop that's a little bit more aggressive than oil, that I do recommend to patients over a set period, is something with sodium bicarbonate in it. So I never recommend that people do a home mix of sodium bicarbonate because you can't get the proportions right. But a sodium bicarbonate drop will fizz and it will just agitate the wax a little bit. So if we've got any stubborn last little bits, it can be a really nice way of just getting those to move out a little bit so that then they're easier to remove. With sodium bicarbonate, in my clinic, I would say that people are good to use it for a week and then somebody should be looking in their ears because it's more abrasive. So it can just take off that top layer of epithelium, that top layer of skin, and that leaves you a little bit more prone to ear infections. If you're using it for 3 weeks unsupervised, I'd be concerned, but for a week if somebody's looking in, then it's a really nice option. So that's those, and then you've got things like AudiClean. So I have patients who speak really, really highly of AudiClean. Now, because I do my microsuction, it's not a product I use an awful lot. It does have, it's got bicarbonates in it, which is okay, so you just not be using it over a hugely extended period. I think I'm probably going to do a separate video on products like this, probably on my own ears, just over a week or two with the camera, so you can have a little look inside and see what it's doing, before I say this is the one to go for, consider it, and whatnot. And then this, so ear calm, I would say that this is a medicine cabinet essential, not for the use of, not for the removal of earwax at all. So ear calm does literally what it says on the packet. If you've got really tickly ears, it's a brilliant little spray. And the reason for that is because it contains a little bit of acetic acid. And what it'll do is just kill the very start of an infection. So I'd say that if you're starting to get a tickle, or if you think you've got an infection and you can't get to the doctor, so that's an outer ear infection, discharge, smelly infection, we need to go to the GP really, because we need the proper medication, but this can be a really good kind of first port of call. Yes, I'm a big fan of ear calm. So that gives you a little bit of an overview of the types of product that are out there. I'm also going to do you a video on how to put drops in, because for me, we've been taught how to do that wrong for years and years and years. And yeah, but that's another story. So yeah.